All right, come on in. Go ahead and have a seat here. How are you today?
I'm doing good. How are you?
I'm really good. So, my name's Jessica. I'm going to be your nurse today. What's your name?
Shalise.
All right, can you tell me your full name?
Shalise Ryder.
Okay. And can you confirm your date of birth for me?
1/2/87.
Perfect. And so that would make you 33.
Mm-hmm.
34. You're going to be 35 in January.
Yes.
Gotcha.
Don't remind me.
All right. What's bringing you in today?
Just my annual checkup.
And are you currently taking any medications?
Just a multivitamin.
Do you have any allergies to medications?
To penicillin and to IV contrast and shellfish.
Do you have any other food allergies? Okay. Do you have any seasonal allergies?
No.
What do you do for work?
I'm a mental health nurse
Okay. Where do you work at?
here in town, downtown.
Do you like it there?
Yeah, I like it.
Good.
Night shift sucks, but it's okay.
Night shift, huh?
Oh, yeah.
Are you married?
I am, yes.
Okay. And do you have any kids?
I have 3.
3. What are their ages?
17, 9, and 1.
Oh my goodness, that's quite the spread.
Yes.
What's your living situation like?
We just bought a house actually, just this last year.
Congratulations.
So. Yes,
That's awesome.
thank you. Yeah.
Good for you guys. Just bought a house. Good. And it's you and your husband and your kids?
Yes.
Do you have your kids full time?
Yes.
Great. Do you feel safe in your current living situation?
Oh yeah.
All right. Tell me a little bit about your medical history.
Not much. I mean, I've had 2 of those kids. Other than that, nothing crazy. I had COVID back in April.
April 2021?
Yeah.
Okay. Have you had any past surgeries?
Yeah, I had besides like dental stuff, I've had tonsillectomy.
Okay. All right, let's talk about your family history. What about your mom? What's her medical history like?
She just got diagnosed this last year, or just the last couple of years, with congestive heart failure.
Oh, okay.
Due to a previous infection.
Okay. How old is she?
She's 55.
And just last year, so she was 54 at diagnosis?
Yeah.
Okay. How about your dad?
Nothing.
Nothing.
They're looking into high blood pressure right now, but that's about it.
How about your grandparents on your mother's side?
My grandfather died recently, like within the last few years. Just being older age, nothing noted. Her mom died when she was in her elementary years of colorectal cancer.
Okay.
Which actually they found to be a genetic trait, and I do not have though.
Okay, you've been screened for the gene. Okay. How about your dad's parents?
My dad's mom died of cancer, lung cancer.
Okay.
She was a heavy smoker.
Okay.
And then my dad's dad died of liver sclerosis. He was a drinker.
Okay.
And both my grandfathers were military.
So, family history of alcoholism
Mhm.
also? Okay. Do you have siblings?
I have one younger brother, and he passed away in a car accident.
Okay. Sorry to hear that.
Oh, thank you.
But he was healthy
Yeah.
prior to the accident? Are you having any pain today?
No.
Alright. Are you experiencing any kind of headaches at all?
No.
Okay. Have you ever experienced seizures?
Nope.
I know you said you work nights. What's your sleep schedule like?
Yeah, depending on the day. If I work, I'll come home, nap for a little bit, get up for a little while, and then nap for a little bit.
Okay.
And then it's normal on a everyday night.
Do you think that you're getting enough sleep?
Probably. I mean, reasonable. I mean, it's definitely probably not as much as most people, but enough that I feel functioning. I don't feel too horrible with it.
Okay. All right. And how would you describe your mental health?
Fine.
Good?
Mhm.
All right. Do you ever have thoughts of harming yourself or others?
No.
Any thoughts of suicide or suicidal ideation?
No.
No.
Mm-mm.
Are you having any weakness, numbness, or tingling in your extremities?
No.
Okay. Any dizziness ever?
No.
Okay. Are you having any difficulty breathing ever?
No.
No. Okay. Any chest pain with deep breaths? Nothing like that?
Nope.
Okay. Do you smoke?
No. Never.
Okay. Anyone in your home smoke?
No.
Okay. Do you have a history of asthma?
No.
Do you have a current exercise regimen?
I mean, depending on my days, I try to go for walks and things with the kids and go out and do things with the kids on my days off. The days I work, I can only nap during the day, so.
Okay, understandable. Do you, on those walks or anything like that, do you ever experience any kind of chest pain with exertion?
No.
Any chest pains at rest?
Mm-mm.
Ever experience any heart palpitations?
Mm-mm.
Do you know the last time you had blood work done?
I'm pretty sure it was last year.
Last year.
Mm-hmm. When I had my baby, they always do boatloads of it, you know.
Sure, yeah. Tell me about your diet.
It varies. I mean, I try to be pretty healthy with it, but obviously there's an occasional eating out here and there.
Right. Do you think that you're getting adequate fruits and vegetables?
Oh, yeah.
Are you having any stomach problems? Any heartburn or indigestion of any kind?
No.
Are you having regular bowel movements?
Yes.
No diarrhea or constipation ever?
No.
Okay. Any trouble with urination?
No.
No. Do you ever get up in the night to use the restroom?
Every now and then, but nothing to like write home about.
Okay, nothing regularly.
No.
Good. Are you experiencing any kind of sexual problems or concerns?
No.
No STD concerns?
No. Mm-mm.
When was your last period?
I don't have one. I have the IUD.
Okay. Which IUD do you have?
The Mirena.
You said you had 2 kids, right? 2 of your 3 kids you had. Are those the only pregnancies that you've had?
Yes.
Okay. And how were those deliveries?
They were good. I had some on and off high blood pressures with my last pregnancy, which resolved after having her, of course, but normal vaginal delivery with that one. And then my older daughter, long labor, but I ended up with a urethral tear, but.
Oh gosh, okay.
Yeah.
Do you know when your last pap smear was?
Last year when I was pregnant with my daughter.
I know you're young, but have you ever had a mammogram?
I actually did, because the first part of my pregnancy with my daughter, they were doing an exam and they felt something, and so they were concerned and wanted to get it checked out. It ended up just being normal breast tissue. It was nothing abnormal. They just wanted to be better safe than sorry.
And that was when you were pregnant, so
It just
a year and a half or 2 years ago?
Yeah. Mm-hmm.
Okay. And they found it was normal breast tissue. Have you had any concerns since then?
No.
Are you doing regular breast self-exams?
Yes.
Okay.
Mm-hmm.
Alright. Do you have any concerns with your bones, joints, muscles?
No.
No pains, nothing like
No.
that? Okay. And last but not least, do you have any skin concerns?
I know.
No rashes or anything?
No.
No.
Great that I've noticed.
All right. Well, Dr. Anderson should be in rather soon to talk with you, and I'll get all of this to her. So I hope you have a great day.
Okay, thank you so much. I appreciate
You're
it.
welcome. It was nice to meet you.
Nice to meet you too.
Bye-bye. All right, come on in. Come have a seat here. My name's Jessica. I'll be your nurse today. How are you doing?
I'm doing okay. How are you?
I'm really good. Can you confirm your full name for me?
Ashley's.
Okay, and last name.
Writer.
And then tell me your birthday.
1/2/87.
All right. That'd make you a 34.
Yes.
Yeah, great. What brings you in today?
I think I might have a UTI.
Oh, okay. And I'm gonna go through all my questions and then we'll come back to visit that, okay? Are you on any medications currently?
Just normally a multivitamin.
Okay, and have you taken any medicines to try to help this UTI?
I've been trying Pyridium at home.
Do you have any allergies to medicines?
To penicillin.
Okay, and any food allergies?
No.
Okay, how about seasonal allergies?
No.
And what do you do for work?
I'm a nurse.
Okay, where do you work at?
I'm in the mental health facility here in town.
Okay. Do you like it there?
Yeah.
Good, good. Are you married?
I am.
And do you have any children?
I have 3.
Okay. And how old are your kids?
17, 9, and 1.
Oh gosh. Okay, that's quite the spread. 17.
We have a party.
Yeah, definitely. Well, tell me about your living situation.
I have all 3 kids with us, and we just bought a house this year, so
Great. Congratulations.
Yes,
Good for
thank you.
That's awesome. It's crazy in this market, you know.
Oh my gosh, it's been a struggle.
Yeah. Do you feel safe in your current living situation?
Oh yes, yeah.
Great. Tell me about your medical history. A little bit about your medical history.
I had COVID back in April, and I have 2 kids, but other than that, nothing.
Are you having any like continuing symptoms after having COVID in April?
Mm-mm.
Great.
No.
Great. And have you had any surgeries in the past?
Just my tonsils.
You had them taken out?
Yeah.
All right. Let's talk a little bit about your family history. Let's talk about your mom first.
Okay.
Does she have any significant medical concerns?
She has congestive heart failure.
Oh, okay. And about what age do you think that started?
She was 54.
And then how about her mother?
She had cancer, colorectal cancer.
Okay. And her dad?
He just old age.
He did pass away though?
Yeah. Mm-hmm.
And then how about your dad?
No, nothing really met with him.
No. Okay. And then his parents?
My grandmother died of lung cancer.
Okay.
And then my grandmother died of liver cirrhosis.
Okay. And do you have any siblings?
No.
Okay. Are you, besides this UTI that you think you might be experiencing, are you having any pain anywhere else in your body?
No.
No? Okay. Good. Are you experiencing any headaches ever?
No.
Have you ever had a seizure?
No.
Okay. How's your sleep schedule?
I mean, I work night shifts, so it's a little all over the place, but for the most part, it's pretty good.
Okay. Do you think you're getting enough sleep?
I mean, with kids and work, probably not,
Sure.
but enough that I feel maintained.
Good. I'm glad. And how would you describe your mental health?
I feel fine. I think it's normal.
Okay. Do you ever have any thoughts of harming yourself or others?
No.
Any suicidal thoughts?
No.
Okay. Have you ever experienced anything like that?
No.
And then are you having any weakness or tingling or numbness in any of your extremities? Hands, feet?
No.
No. Okay. Any dizziness?
No.
Okay. Are you having any difficulty breathing at any time?
No.
No, not with exertion or anything
No.
like that.
Mm-mm.
Any chest pain with really deep breaths?
No.
Okay. Do you smoke?
No.
Have you ever smoked?
No. Mm-mm.
Does anybody in your household smoke?
No.
Right. Do you have a history of asthma?
No.
Okay. Do you have a regular exercise regimen?
I just try and do what I best I can to get out and do something. So, I mean, mainly on my days off, we'll go for walks with the kids. We'll do things
Okay.
out and about with kids, ride bikes, those kind of things.
Okay. And do you ever experience any kind of chest pain?
No.
These glasses are driving me nuts. Never any chest pain, even like with exertion or at rest.
Oh, no.
Do you ever experience any heart palpitations?
No.
And do you know the last time you had blood work done?
Last year.
Do you know what month?
Gosh. Towards the end of my pregnancy, they did a bunch of labs with my daughter, so it's been about a year and a half.
Okay.
So, gosh, like February.
Okay. And then tell me about your diet.
It's all over I mean, for the most part, I mean, I try to eat healthy, but, occasional eating out here and there, but other than that.
Do you think you're getting in enough fruits, veggies,
Oh, yes.
proteins,
Yes.
good balanced diet?
Mm-hmm.
And do you have any stomach issues or any concerns with your stomach?
No.
Any heartburn or indigestion?
No.
Okay. Are you having regular bowel movements?
Yes.
Any constipation or diarrhea ever?
No.
Having any trouble with urinating?
Yeah, I'm not having trouble actually urinating, but I'm having like urgency and definitely pain when I go.
Any frequency also? Like
Yeah.
Is it causing you to lose sleep at night?
Yeah, because I'm having to get up so frequently.
Okay. I still have a couple more questions about that, but I'm going to continue on with this for a moment. Are you having any kind of sexual problems?
No.
When was your last period?
I don't have one. I have an IUD.
Okay. You said you have 2 kids.
Mm-hmm.
Are those the only 2 pregnancies that you had?
Yes.
And did you have any concerns or issues in your labor and delivery with your children?
My older daughter, I ended up with a urethral tear that had to be fixed and had a catheter for a little while after that. My second pregnancy, I had some hypertension towards the end of the pregnancy, but other than that, there was no issues.
Okay. And when was your last PAP?
While I was pregnant with my last sitter.
Okay. Have you ever had a mammogram?
I did have a mammogram because when I first got pregnant with my daughter, they were doing an exam during my PAP, and she felt a lump that she thought was something there, so she wanted to get a test out, just be safe than sorry. Okay. It was found just to be normal breast tissue. There was nothing significant.
Do you still notice that lump there ever?
I mean, it feels normal to me, but she was just concerned. Okay. So,
are you doing regular self-exams of your breasts?
Yes.
Great. Do you have any other concerns related to that?
No.
Okay. And do you have any concerns with your bones, your joints, or your muscles at all? Any aches or pains or anything unusual there?
No.
No. Any skin concerns?
No.
Okay. And then let's circle back to that issue that you're having with this UTI. When do you think that started?
It's been about 3 days or so.
Okay.
And it's just been progressively getting worse over the last few days.
Okay. And you mentioned pain with urination, burning, and frequency. Okay.
And definitely urgency too. Like, I gotta go now.
Okay.
And like we said, keeping me up at night and having to go so much throughout the night.
Okay. I know you said you have the IUD, but do you mind if we do a pregnancy test today?
Yeah, that's fine.
Okay. And then can you said 3 days. Is there anything that makes it better?
Obviously I've been trying to drink plenty of fluids and cranberry juice and all that kind of stuff. And the Pyridium does make it feel a little bit better.
Okay. All good information. Hopefully we can get this onto the doctor and get this taken care of for you today.
Okay.
I'm gonna go ahead and get all of this information to the doctor, and she should be with you in just a few minutes, okay?
Okay.
Do you have any other questions for me or any other
No.
concerns? Great. I'll see you soon.
Okay, thank you so much.
Have a good day.
You too.
Okay, so self-reflection, what do I think? I recorded 3 total videos for this. This will be the 4th video that I recorded. The first video, I mean, I felt like I was rushing through questions pretty bad. I feel like I asked all the same questions. I don't think that it went any, like I don't think there were additional questions or less questions than I asked in the videos that you saw, but I was definitely rushing through, and where our requirement for the videos was 10 minutes, my first video was only like 6 minutes and 30 seconds. And so then I went back through, I read through the questions, and then going back and asking again and kind of being more self-aware and bringing my like speed of my voice down a little bit and kind of getting more comfortable in asking the questions. I definitely felt that helped for sure. I don't know. Otherwise, I think that I felt pretty confident. I mean, I feel like when you're in that situation where you're taking those kinds of history questions, if I can think back to like when I've gone to the doctor's office and they've asked me those same types of questions, the MA or the nurse or whoever it is that's asking the questions really just clicks right through the computer screen and it's over pretty quickly, and they, you know, most of the time it's not the nurse who's creating a care plan or anything like that. It's the doctor who then comes in and makes the plan for the patient and how to treat the patient and what's going on. So I feel like I did pretty well. I think that if I did have to create a plan of care for this patient who had a UTI, that's something that I could absolutely do. I feel pretty confident overall in how I did. So that's all.